Christ Hospital is located in Cincinnati, Ohio. The main hospital is in downtown Cincinnati, and then there's a satellite hospital in Liberty Township, which is north of Cincinnati. We're very excited about our multidisciplinary approach to treating patients with pelvic floor disorders that occurs between urology, gynecology, urogynecology, and colorectal surgery, as well as having this pelvic floor center in which all of us can evaluate and treat patients.
The multidisciplinary collaboration here is pretty remarkable. We've got some outstanding physicians with an incredible wealth of experience, breadth and depth of experience to work together collaboratively to lead to the best outcome. And I often work with Dr. Cox and Dr. Karram to help patients with complex pelvic floor disorders and urologic diseases. Dr. Karram and I work together on patients who have abnormalities that cross all three compartments of the pelvic floor. I specialize in the posterior compartment, and he specializes in the anterior and mid compartment. So if a patient comes in with combined abnormalities of those three compartments, we'll operate together to fix everything at once so that the patient doesn't have to come back for multiple operations.
Urology has always been at the forefront of technological advances in surgery. We have the Da Vinci robotics for treatment of prostate cancer, various other cancers of the urinary tract, including kidney and bladder. But it can also be used for certain disorders of the pelvic floor. We're involved with doing urinary diversions that go along with bladder cancer. In addition to cancer, there's also a lot of reconstructive procedures that we can do using the Da Vinci system, including some congenital obstructions of the kidneys and urinary tract, but also some post-traumatic obstructions that occur from other surgeries, surgeries to treat other cancers, radiations, etc. One of the areas that we collaborate frequently in is our Pelvic Floor Center. And typically that's a collaborative effort between urology, urogynecology, and colorectal surgery.
The Pelvic Floor Center is a center that's in our medical office building, which is attached to the hospital here. It's basically a diagnostic and outpatient treatment area. On the urologic side and the urogynecology side, we do all our cystoscopies there, injections of Botox into the bladder, we do all of our bulking agents, percutaneous nerve evaluations for patients for sacral neuromodulation, we do all of our urodynamics. There's a C-arm to do video studies and fluoroscopy studies. That's kind of on the urologic side. And then we have on the colorectal or GI side, we have anal ultrasound, endoluminal anal ultrasound. We have the ability to do anal manometry and all of our colorectal testing. And then from a treatment standpoint, we do all of our laser and radiofrequency vaginal treatments. I actually did the original research on a fractional CO2 laser called the Mona Lisa Touch. And that has revolutionized how we treat a very common problem called vaginal atrophy in women that go through menopause. Historically, the only way to treat that was with a hormone to replace estrogen, and unfortunately there's lots of women who can't take estrogen. And then more recently I've been leading a lot of the research on a new radio frequency, this Empower platform with this radio frequency offerings, and this is a different type of energy. This is basically heating the vaginal canal. This is the handpiece for the Morpheus. This allows microneedling of the vaginal canal, penetration of very small needles at 1, 2, or 3 millimeters based on your desired depth. And again, this technology is very, very popular to tighten skin of the face and the body. This is a very robust treatment. We are doing multiple studies on this, and we're seeing excellent outcomes in patients that have vaginal atrophy, patients that have bladder dysfunction, whether it be urgency and frequency or urinary stress incontinence. It also is very good to tighten the walls of the vagina and tighten the skin around the vagina. So this is called the Forma V, and it just allows you to heat up the vaginal skin without penetrating it. And this is traditional radio frequency. This is the only bipolar radio frequency device that does this. It heats it up to about 43 degrees, and we heat that area for 7 to 10 minutes, and it starts to create changes that are very positive on a superficial basis. So it's a great center. It makes us as physicians a lot more efficient, and it's a lot more comfortable for patients because it's a one-stop shop for them.